It has been close to a week since healthcare workers began protesting in several administrative regions, calling for a 50% increase in salaries, an equitable distribution of risk allowance, the provision of adequate personal protective equipment, and for salaries to be paid on time. Across regions 3, 4, 6, and 10, hundreds of health personnel have held placards and sounded their voices in the sweltering sun, all to no avail. To add insult to injury, First Vice President of the Guyana Public Service Union, Don Gardner, told Nightly News via telephone on Tuesday that the union has received reports of health workers being threatened as a result of their participation in the industrial action.
Unfortunate that you will have employer representative or employer just, threatening workers, and we're taking the threat very serious.
Gardner added that the Ministry of Health is yet to engage the union for an amicable solution to the workers' grievances. On Tuesday morning, several nurses and doctors of the Guyana Public Hospital again took to the streets, marching in solidarity in front of the institution and around its environs, iterating calls for improved working conditions and emoluments. Last week, Minister of Health Dr. Frank Anthony had implored the health workers to be patient until the budget is approved for frontline workers to benefit from the $150 million that was allotted for risk allowances. The $329.5 billion budget was passed on Friday, but the nurses and doctors say they are still in need of salary increases. Moreover, they have expressed that every healthcare worker should be granted a risk allowance, not only those who care for COVID-19 patients. Meanwhile, President Irfan Ali, during a recent visit at the proposed site for the construction of the new Demerara Harbor Bridge, was questioned by reporters regarding his perception of the demands by the health workers.
I have seen requests that are outside of the scope of what the country can afford. For example, I've seen requests for duty-free across the board, it seems. Right? For nurses, I've seen
up to 6 years of service.
Well, then you can go to all categories of workers.
Temika Rodney reporting for the HGP Nightly News.